Hello, hello, hello. Hi, and welcome. I am Sylvia Hayes, and you are watching Good News at Prime Time. We are a weekly show, and we hope you can join us all the time. And be sure you subscribe to Square Miles Media so you can see all the shows that's coming up. Every time we have a show to come on, you'll be able to watch it, okay? Subscribe, Square Mile Media, and that is where you can find all our shows. We have a good show tonight. We're going to be talking about dental hygiene and importance of being healthy, have a healthy mouth, shall I say. It's so important. We don't realize how important it is, how it affects your whole body, literally your whole body. So we're going to be talking about that. Also, good news. We got to talk about my book. What is it? Power Thoughts. Power Thoughts, empowering you to be successful in life. That is a very good book. And the thought for today from the book is you control your destiny. You have the power to succeed. Let no one discourage you from reaching your mightiest dream. That is the power, the thought from the power. That is the power thought from the book today. Trying to talk too fast here. Okay, the power thought for the book from the book today. You control your destiny. You have the power to succeed. Let no one discourage you from reaching your mightiest dream. And also, you take care of your body, and your body will take care of you. Take care of your body, and your body will take care of you. If you do all the right things for your body, you won't have a problem with being sick all the time, having all these aches and pains and all of that good stuff, because you're going to take care of your body. And when you do that, your body going to love you and treat you well. And so for our topic today, we're going to be talking about dental hygiene and all the things that that's required of us. And I'm going to bring on my host, Mr. Reggie Drama. Hi, Reggie. How are you doing today?
I'm doing great there, Miss Sylvia. It's powerful. I feel so good. I mean, it feels good to be alive. Like you say, I think a part of success is just acknowledging life itself and being a part of it. And one of the things that help you, enjoy life is your mouth, your smile. When people see it, you see people feel bad, they don't smile, they tend to, because they don't want to open their mouth, but that can mean a lot to us. That controls your self-esteem, everything, how clean your teeth look. even your breath. I mean, because people don't want to be in a room with. Well, you don't want to be near too many people with what we call halitosis, a
Yeah,
bad breath,
halitosis.
or
Right.
the toilet, the mouth smelling like a toilet bowl, stuff like that. So, personal hygiene starts with the mouth, and pretty much a lot, because when you start looking at people, and their mouth determines a lot about how they feel. Because if you got a toothache, you don't want to talk to nobody. You want to open your mouth. I remember I had a toothache, and I couldn't get no air. You know, anytime any air came in my mouth, oh, my head was hurting. All that type
Mhm.
of stuff. And if we can
Right.
take care of our teeth, I think one of the best powerful tools they showed us this. You know what this is?
Yeah, toothbrush.
Toothbrush. You remember when they used to put that little red dye in your mouth to see if you was
Yeah, when
brushing
you
your
go to
teeth?
the dentist.
Yeah,
Yep,
well,
I remember that.
yeah. Now some kids, their mouth looked like they had been eating 5 hours all day, but they didn't brush their teeth, and the teacher could tell if you brush your teeth because your mouth was lit up red, and people were half brushing. Uh,
Hmm.
and I think about it, even though I don't know when they invented the toothbrush, but it's been around for a long time,
Yeah,
and it's got some advancements. They got the toothbrush that has the water, like the water pick. The water comes out, and that helps. And even they got different angles, because if you look at this brush right here, it's got different angles, and plus this brush is made from bamboo wood.
mm,
It's supposed to be gentler on the gums and all that type stuff. And we learn a lot about uh, our teeth over the last couple of years, and the relationship between our teeth and our health.
right. There is a lot of relationship. And when you were talking about brushing your teeth, a lot of people they just brush the upper part, well,
Mhm.
from the bottom, the upper part, and the top, the lower part of your teeth, and miss the gum lines. And that
Oh,
gum line is so important. That's where you get all the germs and the bacteria. That's how the the gingivitis form, because you don't get that plaque from the gum lines, and it ease up in there sometimes. And so that is very important. A lot of people don't really know how to brush their teeth. They just go swish, 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 and that's good, because when you swish and swishing, you want to get, that's when you get in the gums, at the end of your gums. You want to get that, but then to get all the bacteria from in between the teeth, you're going to brush down. Brush down from the bottom and up from the down from the top and up from the bottom. You do up and up and up. You're still gonna do this number to get the gum lines to get up in there. So that's important, and also get inside and your tongue and the roof of your mouth. And if you could get the tongues and cheeks, that would be good too, to get that plaque out of there and that bacteria, and rinse your mouth real good. You know, I know for me, before I brush my teeth, I floss. Because I'm trying to get out of the platform under my gums. So I floss, and then I rinse, and then I brush my teeth. So when you floss and rinse, the plaque and stuff you got out, you can rinse that out real good, and then you can go through and brush and get the rest of it out. And after that, you use the mouthwash.
ah,
Yeah,
well,
to kill any bacteria that's in there, and hopefully you'll have a clean mouth.
and even in absence of mouthwash, there are some things that you can do to really uh, help your mouth. They used to
Mm.
say an apple a day keeps the doctor away. Well, if you eat an apple actually helps. If you, now, I'm not saying you relying on an apple totally, but uh, eating certain foods can help pull stuff off your teeth. This is like a dog. They used to give a dog biscuit. From chewing
Hmm.
on that dog biscuit, it cleaned the teeth. It took plaque and stuff off.
And
And
popcorn is
apple,
too.
what's that?
Popcorn. You use popcorn to help clean your teeth too.
Okay,
Yeah,
okay.
so I
Yeah.
heard about the popcorn. I didn't hear about the apple.
Yeah, the apple, but apple sound, but is good, and it helps the jaw muscles and a whole lot of things. Uh, that's why they used to use when you started to lose teeth, different things they used to replace, and you had dentures, and you would see those Polydent commercials where the couple would come in there and eat an apple. Because if you could eat an apple, that means you can eat pretty much anything. But it's important that we take care of our teeth because even though they got different things out now, one of the first things they used to help people when they lost teeth, they, believe it or not, they used to take teeth out of people's mouth and put it in, yeah.
And put them in somebody else's mouth?
Yeah, those was like the first dentures.
Really?
Yeah, it sounds gross, don't it?
Yes, it does.
I hate, they said drummer gonna always bring in white supremacy, but they used to take teeth from the slaves. They said George Washington, all of them had black teeth in the mouth.
Really?
Okay. Yeah. They used teeth. That was some of the first dentures. Because when you look at it, when people got over here, different things, their hygiene caused a lot of early tooth loss. If you look at a lot of people prior to the dentist being, thought of more. The only time people thought about a dentist if they got in a fight and somebody, and the doctor was the dentist. The doctor just either gave you some painkiller, which was usually alcohol, and just pulled your teeth out. And a lot of people would die for getting their teeth pulled out. All this type of stuff. But anyway, fast forward to where we are today, they found out so many more things. And this is still the standard thing that should be in the toolbox to help you maintain healthy teeth. And they got all these whiteners out now because you see people with teeth that look like piano keys. They're clean. And you never know how yellow your teeth are because of stains, things you've eaten over the years, and just simply old age. But this is another thing: baking soda and peroxide are some things that you could use to keep hygiene. And I say old school Listerine. Now, if you go into the dental area of a store today, it's so many products. It's about 400 different toothbrushes. You got old school toothbrushes like these. You've got the angle toothbrushes. You've got soft, hard, medium, all different ranges in toothbrushes. And then you got the hydro picks where they got the water in there. The ultrasonic. So there are so many advancements. And then when you go into the mouthwashes, you used to just have this old school Listerine. It was almost looked like the color of urine. For lack of a better description. But now you got grape, lemon, peppermint, spearmint. You got so many different flavors of mouthwash. Okay. And then you got mouthwash and toothpaste for sensitive teeth. Because some people can't handle fluoride. There's some toothpaste that don't have fluoride, even though fluoride was suggested to be a powerful thing. But a lot of people don't want fluoride in their mouth.
Right.
You see?
Yep. I understand that. And I just want to say that the mouth is a gateway to germs and bacteria that into your body. It's the gateway for it to start. And you want to keep all those germs and bacteria out of there, because if you don't keep a good germ-free mouth, even though you're going to have some germs, but just to keep it as to the minimum, you're gonna have swollen gum, gingivitis, and all of that kind of stuff. So it's important that you do brush your teeth. And they say brush your teeth twice a day, but I know some people don't brush their teeth twice a day. Sometimes they're looking to get it once a day. And I know the younger people, especially the little bitty kids, they don't always want to brush their teeth. But the parents, you got to make them remember that the teeth that they have, they're going to have for the rest of their life. The 8-year-old teeth, you're going to have them when you get 65. So you want to take care of them, because if you don't, you're going to be toothless. And nobody wants a toothless man. I mean, if you have dentures, they might not, it might be okay when you get old, but you want to keep your dentures, and that way you can smile. Because I've seen people that have bad cavities in the front of their mouth, and when they smile, they do this number right here. They're covering up because they don't want anybody to see their mouth. And so you want to be able to smile freely, because that lifts your confidence, and having that good smile. Floss as much as possible and rinse your mouth, of course. Germs can cause your teeth to bleed, and it can cause the swelling in your teeth and overall the gum disease. If you don't keep that down, your gums can first is gingivitis. Gingivitis is mild. Okay, that's just bleeding and swelling of the gums. But then when you go to the other periodont disease, that's when you have infection. And that infection can go out through your body, and it can cause you to have a heart attack. It can cause you to have a stroke, cause arteries to get hard in your body. And actually, it can cause you to have not mental problems, but brain damage. Okay? So just remember that germs and bacteria in your teeth, in your mouth, can cause you to have brain damage. It can onset Alzheimer's and dementia. And you don't want that. So keeping a clean mouth will keep you from having Alzheimer's and dementia, at least not from that direction. You might get it from somewhere else. I mean, another way, but at least if you keep that out, it won't onset it. Okay, so that is so important to just to know that, and it can also cause you to have respiratory problems. A lot of people don't realize that either, that it can cause you to have respiratory problems, pneumonia and stuff like that. So you don't want that either. Just keep your mouth clean and drug-free, and go to the dentist twice a year at least. Get your teeth clean. If you're not doing a good job and keeping those gums clean and stuff, go, because if you don't take care of the infections and stuff you have, it could cause your bones to decay in your mouth. Your teeth will loosen and they be pulled out. You'll be losing your teeth from infections, and you don't want the infections, and you want to keep your teeth, so take care of them.
It's like the guy said, I was listening to a comedian, and he was telling people, he said, man, he wasn't taking care of his teeth. He said he started eating he said every time I open my mouth, about one or two of them fly out. Because he was experiencing dental loss. Well, one of the things about prevention also is the things that they've used over the years. Like I said, they used to use other people's teeth. And then they started using, making what they call dentures. And then they also use different products to fill the holes or the cavities. One of those products used to be mercury. Well, gold was one of them, but it got too expensive. Okay. So they went to mercury. Now, they used mercury to fill people's mouths all the way up to about the 90s. Then they found out that people had a lot of people in the military, because when they go in the military, you got a cavity. First thing they're gonna do is pour some mercury in your mouth. Fill those holes up. Well, a lot of people started experiencing migraine headaches and things of that nature because of the mercury. Okay. And now you look, they've got more, what they call porcelain. porcelain is a filler. But also when they were putting denture implants and things in people's mouth, they use glue and screws.
Yeah.
Now, titanium was the primary because it don't rust and all that type stuff. But you can have problems where you have abscess, which is the bacteria creates under the partial or the whatever new attachment you have. And when that gets in there, that's why they started using the water pick, because the water pick gets all that stuff out of there. It's a little high vibration, and it's also sonic, and it's getting a lot of that bacteria from under any dentures or things like that. And now they got the implants. You can go in, they can take your whole mouth out. They pull all your teeth and put you some new ones in there. And the process, you see people, because it's changing people's lives, but at the same time, again, it goes to your health condition, because you got to be in good health in order to get something like that. Because if you get 8 to 12 teeth pulled at one time, that's a lot of problems. That's a lot of trauma on the body.
Yeah.
And there have been people that have died, because people say, wow, what happened? Well, they came in, some people that hadn't been to a doctor, don't know they got thin blood, because they ask you all these questions. If you got thin blood, you might not be a good patient, because you'll bleed out. So again, taking care of your teeth at the earliest age possible is good. And it becomes more cost effective over the long run to protect your mouth. So when you look at cavities, gum disease, tooth loss, all that is from just poor hygiene. And when you think about it, the mouth, and I always would think about it, when young people, when they first start kissing and stuff like that. Now, you bringing all those germs into somebody else. What's that thing? Mono. I forget the long-term name from it, but it was running rampant because a lot of teenagers running around kissing each other. And you have a whole school get mono. They say, oh man, so-and-so kiss so-and-so. They used to have these things where you come up and you get a girl $1 and you kiss her. They had to stop that.
Oh, really?
Oh, yeah.
They actually doing that?
Yeah, the girl, they get the best looking cheerleader girl, the prettiest girl, or the football jock. And somebody
when they were doing that as a fundraiser?
Fundraiser, yeah.
Okay, yeah.
They had to cut it out because, a lot of people they be going around all day, all week, poor hygiene, and go kiss somebody. Next thing you know, the whole school got mono.
Yeah. Yeah, that's true.
And these are some good questions. Experience with the dentist as a child that developed, the needles, the sound of the drill. A lot of people, you know what? They rather you punch them in the face than them go to the dentist. Because the fear, and dentists have become more gentler. Used to be a time, looked like the dentist had, well, they still got pliers, but they look like they was in your mouth, or they gave you the sedation to knock you out. Like the first thing they ever used was alcohol. You just drunk enough alcohol to get drunk, and then they start working on your mouth. Then they started using that gas and Novocaine. Now they'll go in and give you the shots, and you'll numb your mouth up. It won't put you to sleep, but because their people have had bad effects from being put to sleep, lungs collapse, different things. And that's not a good feeling to go to the dentist's office, you come out in a coffin.
So you've heard of somebody lungs collapsing when they went to the dentist?
Yeah,
Really?
because they had an adverse reaction to Novocaine.
Oh, okay.
Yeah, that's why they stopped. No, that's why they stopped putting people to sleep.
Oh, okay. Yeah, I
You know,
didn't
they
know that
don't,
because I know when I was younger, I know somebody went to the hospital. They were going to have surgery on their eyes, and it killed them. You know,
yeah.
they died on the operating
Well,
table just from
yeah.
it.
Well. You look at when you're in uh, like some of the fears being going to a dentist. Uh, Now they rub your gums
Side.
before they give you the
Okay.
shot. You know,
Uh huh.
they used to just get the needle back in the day and just stick you. Well, that was a shot. That's just if you bite on something that's kind of sharp, it's gonna affect you. So when the dentist was sticking people, see now they get another chemical that they spread around your gums. It's kind of like Oragel, and it numbs your gums. So when they
Yeah.
put the needle, you don't feel it. You see, and like I say, back in the day when they was using Novocaine, some dentists wasn't nice. That's why they started having to bring dental hygienists who usually was a woman to make sure that dentists wasn't having their way with the patients.
Yeah.
See, so a lot of stuff changed. See now, most procedures they want you alert. They go in your mouth. You can. They'll say you're gonna feel a little bit of pressure.
Mm-hmm.
Okay, a little bit of discomfort, and they'll with the injections. When they hit those nerves, you know, for hours after the procedure, your mouth is kind of numb. You know, I remember I was trying to first time I got those injections, I couldn't feel my tongue. My tongue was so heavy,
Oh, really?
and, and I bit it, and I couldn't feel it. Now, and now this stupid, I I could have bit my tongue off, not knowing because I couldn't feel it. You know,
Oh, okay.
yeah.
I
So
don't remember my tongue ever being numb like that.
depends
I
on where
know
they hit it.
my jaw, my lips felt big,
Yeah, yeah.
something like
Mhm.
that, but I don't remember my tongue ever having that effect. So
And
yeah, just getting bacteria. A lot of times, if you can't brush your teeth, and I know like what IHOP and Waffle House, they have toothpicks. Just grab a toothpick and clean out some of the food
oh yeah,
between your teeth to keep the germs and bacteria from growing. And rinse your mouth with water if you can't do anything else, because all of that food and bacteria in there can cause halitosis, and you
yeah.
don't want that, and you don't want the the other stuff in it. So let me go through a couple of things that periodontal disease can do. Um, People with periodontal disease are 2 times more likely to have heart disease, because it gets into their arteries, it gets in the bloodstream, cause your arteries to harden and causes, you to have heart problems. It can also cause you to have high blood pressure. So a lot of people don't realize that. It can cause you to have strokes and clog your arteries up. Um, Poor dental health can increase your risk of dementia. Of course, I've already said that. And brain damage. Bacteria from periodontal disease can travel through your bloodstream and cause respiratory problems. I've already told you that, but it also can cause you to have pneumonia and COPD. It can prevent it, or you can dismantle it a little bit. You can either prevent it by having good dental hygiene, or it'll make it real minimum so you won't have a major problem with it.
Mhm.
So it's good for that. 95% of the adults with diabetes also have periodontal disease, and about 1/3 also had it so bad that they lost some of their teeth. So that's a bad thing right there. So I was reading where diabetes and periodontal disease, they work with each other, might as well say. Because if you have periodontal disease, a lot of times you're going to have diabetes. If you have diabetes and then that periodontal disease it make it easier because it's a infection and stuff like that. So with diabetes, you don't get rid of infections as quick. So they kind of work together to make you sick. So you want to get rid of it. It can also cause erectile dysfunction. It can cause it 7 times higher in men with periodontal disease than it does without periodontal disease.
Whoa.
7 times higher.
That's gonna make a lot of brothers go to the dentist.
Yeah, and so you don't want that. And periodontal disease it's an infection basically. When it gets in your bloodstream, it could cause all kinds of problems. Because it can even cause a woman to have a baby prematurely.
Wow.
So you want to have good dental hygiene when you're pregnant. Because you don't want that to happen. Okay. Ooh, my hands is itching.
Someone was asking, is there a certain age that you encourage children to go to the dentist? That's a good one. I would think once they start cutting teeth. I know sometimes it can be expensive, but when they get not those baby, but even when they do their baby teeth, because they're indicators early about your children. A lot of stuff, especially in certain communities, we accepted it. You'll see kids with an overbite. Well, that's because it wasn't addressed early. I'm not saying you got to get the 2-year-old with braces, because those permanent teeth don't come until they like 6 or 7. But that's a determining factor on how their mouth gonna look. You see little kids, like when I was growing up, reason I got a gap, I would stick a pencil right in between my teeth, so I could do that, like Tweety Bird. Well, different things cause the teeth to be shaped a certain way, and at an early age, a kid is sucking his thumb. You could tell. Not to put it out like that, it was a girl. You could tell she was a thumb sucker because her teeth protruded out like that. Well, all that can be indicators if you take your kids to the dentist early, and that's why it's good to have dental insurance and things like that for your kids.
It may be an indicator, but there's no need to go to the dentist until after you get your permanent teeth. So I would say after 7, when you start getting the permanent teeth in, because beforehand it's useless because they're gonna lose those teeth anyway. So after 7, 7, 8, 10 years old, when your teeth are coming in, because you're gonna still be getting teeth as a teenager. But you want to go before you become a teenager. At an early age, now when your permanent teeth is there coming in crooked and stuff like that, you want to make sure you go, and might be time to start working on braces or just doing stuff with your teeth, but not earlier than 7 years old.
Well, one of the reasons they recommend that they do it early is to get the child into the mindset not to be scared of the dentist. Okay, if you see, you don't have to. It can be something as easy as teaching them how to brush their teeth properly. You can do that at 4 or 5 kindergarten.
Yeah, that's what parents do. Teach them how to brush your teeth.
Not all parents.
Because when my babies were babies, at first I would just get a rag and wipe the plaque off their teeth as babies. Right. But then when they got a little bit bigger, I bought them the little Winnie the Pooh toothbrush and showed them how to brush their teeth. And I made sure they brushed their teeth. So you have to do that at a young age, and then when they start getting those permanent teeth and they need to go to the dentist, you could go then. But beforehand,
well,
I wouldn't say so. Parents have to
all
take care of the
parents
teeth.
are not created equal. Some parents, it would be word to the wise. You know, if you got parents that's got issues with their mouth, their kids would tend to have issues with their mouth. But if you can,
Yeah,
the fear, if you can get them in there, you just look at certain population groups. Now, it can become a money factor, but it wouldn't hurt to get kids, school age kids, to get accustomed to going to the dentist. If
yeah,
the earlier they do it, the more comfortable they're going to be, and that's really the reason they back the age down lower, because everything now is around prevention. Okay,
yeah.
yeah, you know, that's one reason you have vaccines. I'm surprised they don't have a cavity vaccine. The only reason, you know, is they probably have one. You don't put it out, but they
Well, the
could.
fluoride, what they putting on your
Yeah,
teeth.
fluoride used to be, and you see people are backing away from fluoride. They're pulling, you know, used to be a time where all the major toothpaste people would put out was fortified with fluoride. But now
Mm-hmm.
we found out that fluoride wasn't what we thought it was in the long-term effect. So about every 40 years, like I say, mercury, once they found out that mercury was giving people migraines and headaches and all kind of weird stuff, they stopped putting mercury in people's mouth.
Yeah, and those people who has mercury in their mouth need to get it out. And you
Oh
need to
yeah,
go to a special dentist to do that, because everybody may not know how to do it. Because
yeah.
if they take that mercury out of their teeth and they let it flow into their body, it can poison them.
Oh yeah, yeah. You get
They have
poisoned.
to have special skills to get that mercury
Yeah,
out.
yeah. Think about that. Now, mercury is considered a hazardous waste product, and people carry it around in their mouth.
Yeah.
Ding, 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 ding. Light bulb moment. But as we get smarter as human beings, beings, we master certain things. Like I say, if you look at the history of oral or dental hygiene, for instance, the doctor used to be the dentist. Then they developed the dentist. After that, you got, if you go to the modern day dentist, the dentist is just the preventative guy.
Mm-hmm.
Okay. After the dentist, you got a oral, it could be an oral surgeon, because in order to go in and extract teeth from the body, you have to be a surgeon. So that's another specialty that the dentist alone can't do. The dentist, he'll say, just say if you got young kids and you can determine that they're going to have an overbite. Well, at 4 or 5 years old, a dentist can recommend an oral surgeon to come in and do some preventive work. And then they also have other specialists. You know, now you go into some of these dentist's office, they're about 4 or 5 different specialists. You know what I'm saying? You even
Mm-hmm.
the person that some dentists don't even administer the shot.
Mm.
Okay,
It used to
they
be they
have,
do everything.
yeah, right, but because everything is so specialized now, uh, and yeah, and you can say it's about the money, but it puts people in a position where you got a specialist. You know, if whatever you're looking for, just for instance, I went to where they got a system. They come in before I even would see the dentist. The it was like a motivational person. They said, "Well, what do you want?" They noticed I had missing teeth. They said, "Well, do you want to? Why do you want missing teeth?" They talk to you, all that type stuff, and then probably the fourth person I met was the dentist.
Really?
Okay. Well, they also got to have the person that come make sure you got some money. Okay,
Yeah.
that's in there too.
That
Because a
before
lot
you
of
see the
dentists,
dentist.
yeah, before you see the dentist, these folk, you got the marketing person that's gonna come in and be like, well, "How do you want your mouth to look, Mister Drummer? Yada yada yada. What are your reasoning? Blah, da, 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 da." Then somebody comes in. If we could get arrangements and this and that, how do you manage? Or you think you're gonna pay for it? You got insurance? Yada yada yada. Then you got a person that comes in and talk to you about your family history, all this type stuff. you know, and then the dentist comes and look at you. The X-ray person is in there somewhere, takes a picture of your mouth, gets the X-rays. So by the time the dentist comes, the dentist is looking at your chart. I see you're missing. They call it number 32, number 18, number 9. They'll read out
Yeah.
the numbers. That looks bad there. That's not going to. This is what, and the dentist will come up with an overall what he recommends. And then the oral guy come in and say, "This is what we got to do. The procedure. The procedure is going to involve this, and that. We're going to do this, and then if we got to remove anything, you got broken teeth, any of those things, the oral surgeon is going to take care of that, and then we're going to wrap it up. And then there's a guy that got a fix. He comes in, and they don't, like I say, back in the day, they used to pull teeth out of people, just stick them in a little thing. Now they got a 3D processor that makes the teeth just for you. So that's another guy that comes in, and they have to come in and fit you for all that. And next thing you know, they'll have you with some teeth. I mean, it's so the modern day approach is good, but if you could keep your teeth for your longevity of your life, it's a beautiful thing, because all you're doing is just getting cleanings. And there are people that have never had to get fillers, but they don't eat a lot of sugar, a lot of sweets. They brush and maintain their mouth. And those things, and that's why I say now they're doing everything early. Even with kids now, some people say, my little Johnny, we gonna teach him as you go. Well, little Johnny might have some problems early, or even into his extended adult life, because not being introduced to the practice. I see some things here. See, over service. It's important for all ages. Yes. And when you think about it, this is something we're showing here. Thank you, Mr. For all this stuff, because everything now is about prevention. Okay.
Yeah.
And prevention, an ounce of prevention is definitely
Worth a pound of cure.
or a pound of gold.
Most definitely. And
Yes.
there are so many things that contributed to having bad teeth, like smoking,
Yeah.
chewing tobacco, and
Yep.
sugary foods and drinks, all of those. And like a lot of times people, they eat sweets or candies and cookies and stuff, and they don't rinse their mouth, or eat a cookie and go to bed, drink a Coke and go to bed. They leaving all that sugar on your teeth so it can get that bacteria and eat away at the enamel and stuff. So it's best not to do that. If you're gonna drink a soda or something, rinse your mouth. You're gonna eat cookies and candy, rinse your mouth to get some of that stuff off of your teeth. So your teeth can last a little while longer, because you don't want to cause those kind of things. And when you have a toothache, it's horrible. You don't want toothache. And having bad teeth, sometimes people have bad teeth and they don't really know that it's causing the problems that they're having. Because sometimes I've seen time where people their whole face was swollen up because they had an infection in their tooth. You don't want that to happen. And so not only does it bother your tooth, but it can cause you to have headaches, cause your blood pressure to go up, and it also can make you blind. Some people don't realize that, but your teeth can actually cause you to lose your vision.
Mm,
because of all the bacteria and stuff in there. And all of this stuff is right here together. And
right,
if you it can also mess with like the upper teeth in the back here. I guess you can call them the molars. They're close
right,
to your sinus cavities. So if your tooth is infected, it's going to affect your sinus cavity. And sometimes that can cause you to be dizzy. And
right.
a lot of
Mm,
people didn't realize that either.
yes,
You know,
yes.
your tooth can cause you to be dizzy
Mm.
and lightheaded, and you don't want that. Is it can
Well,
cause so much.
well,
It
your
can,
mouth is the gateway to so many things.
yes, it
Uh,
is.
and like, from a physical standpoint, for somebody to see you, you can tell a lot about a person from their mouth. You know,
Mm-hmm.
uh, their how they feel about themselves, uh, how they take care of themselves, um, and mentally it affects how you do everything. Like you say, when you see somebody going around like this, won't say something, won't smile, or in such a degree of pain that they always miserable because I remember this brother. He was always just like this because he was in pain all the time. He couldn't even open his mouth.
Mm-hmm.
He had so much bad problems with his mouth that he couldn't even open it and didn't have a lot to say, short tempered. All these things affect how people, their emotions, their behavior, all around their mouth. When you look at uh, when they, you see now when they show the commercials and people with tooth loss, they come back, they're a whole different person. They smiling, and
Yeah.
even the people that get the tooth whiteners, because one of my buddies got those teeth clean. Man, I was like,
Uh-huh.
man, goodness, whoa! I mean, teeth look like a piano board, clean.
Yeah.
You don't, they don't mind smiling. When people don't like to smile, they want to hold their head down and all this type of stuff. So your mouth can affect. Now think about this: how it is in young people, because see, young people now are more vision orientated. It's about how
Uh-huh.
you look. Okay, if you got a bad grill at an early age, now the older you get, it's been tolerated. People just as it is. Oh yeah, they old, they lost some teeth. But if you in your 20s and 30s, you experiencing tooth loss. That's why they're doing it at an early age, because you can chip a tooth early.
Yeah.
I think uh, my son, he was about 8, and him and another little guy was playing in the room, and that was his permanent tooth that got chipped. Now they had to take that tooth and attach it so they with a glue or polymer to get it back.
The piece that got chipped off, they put it back.
Yeah,
Oh, okay.
yeah. Now, and that made me think, because I was about 8 or 9, and I was like, man, because I was like, whoa, he's gonna be disfigured. Goodness, oh man! And that's been 20 years ago or more. But these are things, because people are more active now. There are more chances of you getting a problem or encountering so many more people. So the mouth is the gateway to everything. You see
Yes, it is.
happier people when you go into senior places. Believe it or not, the ones that got all their teeth, or even if they got dentures or partials or whatever they've got, the level in which they maintain their dignity is much higher. Okay, people
Mm-hmm.
just feel better if they got a good smile, their teeth intact, they can eat what they want to eat. There's some people, and I used to, they have to almost depend on Jello or smoothies,
Yeah.
because they can't eat regular food. You
Yeah,
see,
I
I
know my great
mean,
grandmother. She used to eat an apple with a spoon, and
mm,
I didn't think that it was because of her not having teeth. No, she would cut an apple in half and she would take a spoon and scrape it and
Man,
eat
okay,
it. And I
okay.
thought that was so cool. So I used to do that. Scrape an apple and eat it. That was a fun way to eat an apple. Now
Applesauce.
that I'm thinking about it, she probably didn't even have teeth to eat the
Yeah,
apple with.
yeah.
It takes these many years for me to think about that.
Well, now think as human beings, we make adjustments. If you ever
Mhm.
know somebody, if they missing teeth up here, they got a tendency to keep that lip down. If they missing teeth down here, that lip almost covers them. So
Yeah,
we make adjustments over time, and the body does it almost naturally. Just for instance, if you're missing some teeth and your face shrinks up, you get the your jaw muscles get
yeah,
less.
yeah. All your muscles and stuff, they coordinate with what's in your mouth. Just like
Yeah.
me, I got happy when I was younger and pulled one teeth too many. Cause as a kid when your
How
teeth
you
is
do
missing.
that? That's why they got to go to the dentist at an early age, so you won't do stuff like that.
Yeah, yeah,
Good.
but you know how when your teeth get loose and you wiggle till they come out. Well, I wiggle my permanent teeth, and it came out, and it never did grow back. See, I was young. I didn't know that was a permanent teeth that I took out. So now
Yeah.
my the teeth in my mouth kind of switch a little bit
Mm-hmm.
because that missing tooth.
Okay.
So it,
Well,
it it does make a difference if you
yeah.
have crowded teeth. You can see how your teeth are all crooked in there. So teeth need to come out. That's when you need to go to the dentist,
Right.
to get
Well,
that straightened out. But in my case, I had a missing tooth, and so that teeth that would have been there wasn't there. So all the others kind of swayed over a little bit, and it makes a difference in your mouth. Yeah,
wow. Well,
everything adjusts accordingly.
oh yeah. And now they got those invisible. Back in the day, you had the metal braces. Okay,
Mm-hmm.
remember those? I remember, and see, all that brings a psychological barrier on people because I remember one of the first guys I saw that had braces, we call him chainsaw because it looked like he had a chainsaw wrapped around his mouth because
Uh-huh.
it looked horrible, and everyone was like, I don't want nothing like that, man. Goodness. So, but look what they did. The advancements became where you had, it looked like a little piece of string and
Mm-hmm.
it just some little things holding it, and they became more attractive. Now you got the invisible things where you can wear them at night,
Mm.
invisible liners and things like that.
Yeah.
And there are people at later ages that are getting it because people say, "Drummer, I hated braces when that's because they were painful for people." But now they've made so many different advancements until you can straighten a lot of stuff out early.
Yeah.
Even people in later life are doing things. And that's the beauty. Technology helps us all. And a smile takes away, when you look at a smile and the teeth being in place and the teeth being clean, it can take about 10 years off.
Yeah.
You'd be like, whoa. And I'm gonna tell you a joke. And this is another reason to take care of your teeth. I was in Virginia and there's a girl in there really looking good. And I knew the brother, knew the girl. He came in and it looked like she was having a good time. And the guy said, come in. He said, cause I guess she was supposed to be home. He was one of them controlling guys. He said, you can
Uh-huh.
take them out. He said, you can take them out or I'll knock them out. Well, he was talking about her teeth.
What?
Oh man, I'm gonna tell you what happened. I was probably about 25, 30 years old. He said, you can take them out or I'll knock them out. and she took them teeth out and gave them to him right there in the club. And when I saw her, I was like, whoa. Because, at that age, I was used to everybody having all their teeth. But there was an older guy, and she was probably about 30. And he said, you can take them out or I'll knock them out.
So it was her teeth that he wanted her to take out.
Yeah, well, I guess he was paying for them.
Dang.
He was sure of that.
Not right in public.
Yeah, I think right. Because I just think I would have took the whooping. I mean, but she didn't take him out, and she went back on the dance floor.
What?
Yeah.
Dang. Oh, okay.
Oh, you know what? That's true. If you think about dental hygiene, like I said, young people kissing, they had to stop all that. You think about who you put your mouth over, even what was mouth to mouth resuscitation, all this type of stuff. Even I'm gonna tell you this: when back in the cowboy days, you see somebody get bit by a snake. Well, if you had some jacked up teeth, you don't need to be sucking the venom out.
Right. Yeah.
Because it's going to go right into your bloodstream. So it was not recommended that guys with jacked up teeth suck the blood out of somebody. So he just got to, it ain't nothing I can do. Well, the things that we learn about the mouth, the gateway to almost everything, your health, everything, your wealth, everything. It makes people rethink. Like I say, a lot of things that we used to do, we don't do anymore. Like when they used to let the little teenagers kiss each other and stuff. And when mono came out, they had whole schools being infected. They had to change that. When they looked at the different things that they use to either for feelings like mercury, the apparatus they use to put you to sleep, or whatever. All that's changed now. There's so many new advancements, but at the bottom line, this is still one of the best tools that we can use to maintain good.
Yeah, and when you were talking about the kissing thing, so if you're close to a person and you can tell they have halitosis, you ain't gonna be trying to kiss them anyway.
Oh yeah, ooh, yeah,
because the halitosis is an indication that you have bacteria in your mouth. A cavity in there, infection in there. Because unless you were eating garlic or something like that, that's a different story. But if your mouth smell like boo boo, that's an infection.
Well, and that's a sign that you probably got some intestinal issues, bowel movements not happening on a regular basis, not properly chewing your food. That means that food has collected in the other parts and have not, gotten out of the body. So the mouth is an indicator of a lot of things. When you start smelling, when we smell bad breath, that's coming from inside the other organs of the body. Now, sometimes the tongue, because they say you should brush the back of your tongue.
Yeah.
But it's hard because some people say, man, I feel like I'm going to throw up if I hit the back of my tongue. But that's why you use mouthwash. But a lot of people, because of poor digestion, again, goes to how you eat, how you chew your food.
Yeah.
You got meat that has not been broken down. Now it starts to ferment. And that's when you get that halitosis of bad breath. And I don't care how much Listerine you use.
Yeah, well, if you have digestive problems, that's going to cause it's going to come up too. But then also, if you just have cavities in your mouth and it's like real open, not just a little cavity, but it's deep in there with infected and stuff like that, that's going to cause you to have bad breath.
Oh yeah, constantly.
But let's talk about the pains and some of the remedies you can do, because it's time for us to go.
Okay.
Like if you have a toothache And sometimes you might just have a random toothache with nothing going on with your teeth. You could have a popcorn kernel under your gum or something like that, and it caused you to have pain and inflammation and all that kind of stuff. Just floss your teeth. Floss your teeth and rinse it out with good, warm, hot, salty water. That's one of the things I did because I was having a toothache, and I flossed my tooth. I used warm, salty water that would soothe the gum, and then I use some chloroseptic on it. I did that a few days. My toothache was gone. So what it was just something that got under the gums and caused me to have pain. So that's why it's important to floss your teeth. Because sometimes when you eat popcorn, those kernels can get under your gum, and it stay there. If you don't floss and brush it out real good, it can cause inflammation. Okay, so you want to do that. If you have inflammation on your tooth or like a cyst or something like that, olive cloves. You can get some cloves, put a little bit of that oil on there, on the cotton ball, and put it there. That will help ease the pain. It'll get rid of some of the inflammation in your gum. That helps right there. Again, chloroseptic. Because people normally buy chloroseptic for sore throats, but and it numbs the throat. But you can spray a little bit on your gums, and it numbs the gum too.
Well, also, cinnamon, ginger, and turmeric, and garlic. If you got an infection, garlic, or one of the best things if you got an infection in your mouth is old school Listerine and peroxide. It'll get that abscess out, that infection out. Especially if you're hesitant about going to the dentist during this COVID-19 situation, people got all kind of paranoias. That will keep bacteria down and keep you from probably dying prematurely from abscesses of mouth.
Yeah, and getting that infection down, and that will help with the pain itself.
Oh yeah.
So if you can get, make the pain subside until you can get to a dentist, that would be a good thing. So, the turmeric is good for infections. Yeah. And again, olive cloves is good too. Yeah. And warm salted water is soothing. It soothes the gum and it helps with the pain and stuff as well. So those are some things. And then you want to floss and rinse your mouth. If you have antiseptic or mouthwash or not fluoride, but peroxide. No, either one of those, rinsing your mouth real good with it. And peroxide is good for whitening your teeth also. But you want to be careful with that peroxide and baking soda because it can also make your gums sensitive. If you use too much of it and use it all the time, that can make your gums sensitive. So it's good for whitening teeth, but you don't want to overdo it. Yep. And so those are about the things I can say. Go to the dentist at least twice a year. That's what you're supposed to do. But if not, take care of your teeth. Because if you take care of your teeth going to take care of you. Okay, they won't cause you to have all kinds of pain. They won't cause you to be embarrassed because you are not taking care of them. Because a lot of people, they drink a lot of coffee and smoke cigarettes and all that kind of stuff. And they have these yellow teeth or brown teeth or whatever color teeth. You're not taking care of your teeth. So take care of your teeth. And your teeth will take care of you, make you smile, make you happy. You won't be in pain and all of that other stuff. You won't have a swollen face. You won't be dizzy. If you take care of your teeth, you won't have a heart attack from the periodontic disease. So take care of your teeth. And that's going to be about it. It is so important because you're going to have your teeth for the rest of your life. And you don't want to miss out on steaks and nuts and all of that kind of stuff because you don't have good teeth. And some people might say, I'm going to get a partial, but partial doesn't always work as well as your teeth, unless you've got bad teeth. If you have bad teeth, partial might work better. But take care of your teeth. You don't want partials. You want your teeth, okay? And invest in your mouth. Get the fillings. If you have to have a filling, get a filling. go to the dentist, do what you need to do to make yourself look good and feel good and be happy and healthy. And until then, we're going to say, take care of your teeth. Your teeth going to take care of you. And have a good day. And see you next week.